Critics say the Trump administration's cut to the federal workforce are putting the health of 9/11 first responders at risk. 16 probationary staff members of the World Trade Center Health Program were fired. That's a 20% reduction in staff that manages claims for people who have illnesses related to 9/11. Now the future of the agency is unclear. ABC News senior investigative reporter Aaron Katersky has the latest on that. Aaron, the World Trade Center Health Program was created in 2011, but extended until 2090 to try to compensate this growing number of people who've contracted illnesses linked to what happened down there. So what's the debate now? How are these workers saying the layoffs are affecting the victims?
It's a big program. It covers 140,000 people who were either there on September 11th in the neighborhood, responded afterwards. They've been eligible for compensation because it was deemed a terror attack on the country. And 12,000 people last year alone joined this program. But for as big as the program is, for as many as it serves, it's only administered by a handful of people. And what critics say is this 20% reduction means delays in getting people perhaps the care that they need, and delays in trying to figure out what illnesses that people are still coming up with as a result of their exposure to the toxic dust of 9/11 should be covered by the program in the future. They're calling for these cuts to immediately be restored.
And as you say, Senators Gillibrand and Senator Schumer from New York issued a letter to RFK asking as much, that these cuts be restored, funding be restored. How likely is that to happen?
Well, we don't know. The senators raise a really interesting question in their letter, saying that they can't believe that the Health and Human Services or the administration writ large would knowingly put the health of 9/11 first responders at risk. And the implication is that the administration may not exactly know who they're cutting. If bureaucrats go in and just see names on a spreadsheet without understanding what it is they do, that doesn't really bode well for the kinds of programs that now thousands and thousands of people are relying on for their health. So Senator Schumer, for one, said it'd just be unconscionable for the administration to cut funding for a program that serves so many people that, in large part, and politicians have used this term a lot, have deemed them the heroes.
And Aaron, quickly, any response from the administration to this?
Not yet. We have checked with the CDC to see how this is all going to go down. Haven't heard back yet.
All right, Aaron Katersky, thank you.